It is great to see you all. My name is Carmel Pierre-Louis. I have been working at the MOE clinic for the past 7 to 10 years as an MLT. I'm currently a student at Winston-Salem State University working on my bachelor in the lab. Today, I'm going to talk about the DCA Vintage Analyzer. The goal for this presentation is to have the student understand the difference between A1C testing and the blood glucose testing. At the end of the presentation, the student should be able to operate the instrument according to the manual guideline. Observe safety and chemistry department. Explain the importance of the test to the patient. Identify when there is QC error. Differentiate normal and abnormal results. Perform maintenance activities. The student should pay close attention to the lecture and the PowerPoint in order to meet the objectives. Handout and PowerPoint will be provided. At the end of the presentation, in about a week, a reading exam and a hands-on activity will be administered to evaluate the student understanding of the material. A1C. What is the DCA Vintage Analyzer? It's a semi-automatic instrument that measures the quantitative percent of the hemoglobin A1C. It helps also in controlling type 1 and 2 diabetes. They mainly use it in doctor's office and hospital. The instrument is composed of 4 compartments: the reagent cartridge, the onboard barcode reader, the display screen, and the pointer. It is a spectrophotometer that analyzes intensity of light through the cartridge optical window. No calculation is needed for this instrument. The operator just has to scan the calibration card. The barcode reads it. The system automatically performs the calibration test. Before you do the test, you need to gather some materials: patient sample, control kit, reagent kit, tissue, clock, and gloves. There's a few things that you need to consider before you do the A1C test, because those conditions can affect the result. You need to make sure the patient did not receive any transfusion for the past 3 months, having hemolytic anemia, sickle cell anemia, thalassemia, having removal of the spleen, because that can affect the red blood cell life cycle. To get started, you need to turn on your instrument. For 1 to 8 minutes, you let it warm up. You can select any part on the screen. If there is an error message, you hit OK, and then you follow the message. Before you do the test, you open your cartridge. You need to inspect your cartridge to make sure that there is no missing desiccant, no loose tab. And also, if the pack has been open for more than 60 minutes, you cannot do the test with it. As far as our procedure, the procedure consists of 7 steps. First, you need to collect the blood. Second, clean the capillary tube after filling it with blood. You insert the capillary into the cartridge. You scan the cartridge. You insert the cartridge into the compartment. Then you wait for 6 minutes. After 6 minutes, your result will point out. Then, at that time, you can go ahead and remove the cartridge and we discard it. For the procedure, we will elaborate more when we do our hands-on activities. As far as safety, you need to wear gloves when you're servicing the instrument. You wash hands when you go from contaminated area to non-contaminated area. You do not eat, drink, or wear cosmetic in the lab. Keep your area disinfected. The difference between the A1C and the blood glucose test. A1C check how much glucose is bound to hemoglobin. It is also used to estimate the average blood glucose level. A1C is not affected by daily fluctuation. That's why it is used to monitor 2 to 3 month blood glucose level. On the other hand, blood glucose test is affected by fluctuation, daily fluctuation. That is why they use it as a day-to-day monitoring of blood glucose. As far as QC is performed daily. QC need to be in range to do any patient testing and to report result. If the control is out of range, you need to refer to the guide list for corrective action. Maintenance. Before you do any maintenance, you have to turn off the instrument. You can use water and ethanol for cleaning. For weekly cleaning, you can clean the barcode reader. As needed, you can clean the exterior of the instrument. Quarterly, you can run optical tests and remove the cartridge spring. A1C is a semi-automatic instrument that is used in different clinical settings to monitor type 1 and 2 diabetes. It's a very simple instrument. It doesn't require any special skill. If you need more information, please refer to the operator manual and the package insert. Thank you.